Hello everyone, this is Dr. Garima Sachdeva, one of the mentors of Study MRCOG. Hope all of you are doing well, and today's Wisdom Short is on GDM, where I'll be discussing the important cutoff values which have been asked in exams. So, when a patient comes for a pre-pregnancy counselling, and you take the history and you find out that the patient is a known case of diabetes, then what target you should set which is safe for her to go for a pregnancy. So for fasting blood sugar, which is done empty stomach in the morning, sugar should be between 5 to 7 millimole per liter. Before meals sugar, it should be between 4 to 7 millimole per liter. HbA1c should be below 48, that is less than 66.5%. So FBS 5 to 7, before meals, that is before dinner or before lunch, 4 to 7, HbA1c less than 6.5 or less than 48 millimole per mole. And you should tell them if the HbA1c is more than 86 or more than 10%, then you should tell them that they should not try for pregnancy. They should control the sugars first, because in that case, the chances of congenital malformations are very high. Then coming over to the diagnosis of GDM. So if while patient is pregnant, the diagnosis of GDM is made if fasting blood sugar is more than equal to 5.6 millimole per liter and 2-hour postprandial blood glucose is more than equal to 7.8 millimole per liter. You can remember this with the easy mnemonic 5, 6, 7, 8. Fasting blood sugar more than equal to 5.6, 2 hours postprandial more than equal to 7.8. Diagnosis of glycosuria during pregnancy is made if it is more than 2 plus dipstick positive on one occasion or more than equal to 1 plus dipstick positive on at least 2 occasions. Then coming over to management. The management of GDM depends on the fasting levels. If it is less than 7 millimole per liter at diagnosis, you give them a trial of diet and exercise changes. If blood glucose targets are not met with diet exercise within 1 to 2 weeks, then you go for metformin. However, if the FBS level is more than equal to 7 millimole per liter, then you start the treatment with insulin with or without metformin and along with the dietary and exercise changes. And if the third scenario is when the blood glucose is between 6 and 6.9 and the patient has complications like macrosomia and hydramnios, in that case also you start immediate treatment with insulin with or without metformin along with the dietary and exercise modifications. Now coming over to management targets, like for the antenatal management, once the patient is on insulin or insulin or metformin, what should be your target? Fasting blood sugar, it should be less than 5.3. 1 hour postprandial should be less than 7.8. 2 hour postprandial should be less than 6.4 millimole per liter. Now this was about the antenatal targets. Now how do you monitor blood glucose during labor and birth, and what should be your target then? So you have to do every hourly monitoring while the patient is in labor, and your target should be between 4 to 7 millimole per liter. And if you feel that it is not maintained in this level and the sugars are low, then you have to give them IV dextrose and insulin infusion in this case. So this was about the GDM cutoff values. In case of any doubt, you can get back to me. Thank you so much.